Many women who are trying to get pregnant have the secrets to what's preventing them from getting pregnant right inside their mouths. What? Maybe they're doing everything right and feel like they should have gotten pregnant by now, but their tongue tells me a different story. Give me 5 minutes of your time and I will reveal the 5 most common fertility tongues that I see with my fertility patients. I will describe what the tongue looks like and what that means for my patients and what they can do to improve their fertility health. And for those of you who don't know me, I'm Dr. Gina Rosella Terranoni, and I've helped over 2,000 women and couples to become pregnant and have healthy babies. Drop me a line below with the word tongue to get my top 5 photos of fertility tongues and specific steps to improve overall fertility health based on what these tongues are showing me. So maybe you have never thought about tongue health and how that can tell a full story of fertility health. Let me tell you about the 5 tongues. Tongue diagnosis, as I learned, is based on traditional Chinese medicine, and the tongue is seen as a reflection of our internal health. We look at color, shape, coating. All of this provides insights to us on the balance of oxygen flow, which is called qi, blood circulation, and other fluids and vital substances that all help with fertility health and with getting pregnant. So let's look at the different tongues. So the first tongue is blood deficiency or blood vacuity. It's pale or light colored tongue and can indicate a blood deficiency. Sometimes you'll see the whole tongue is pale or you'll just see the sides. This can suggest inadequate nourishment to the uterus. What happens is this could either be showing signs of anemia, this is showing potential impact on egg quality, or maybe someone who has a pale tongue has irregular menstrual cycles, or maybe they're not ovulating. Another thing that this kind of tongue can show is propensity for a miscarriage. The best way to remedy this kind of a tongue and improve fertility health is by incorporating iron-rich foods like spinach and beetroot into their diet. This will help nourish the blood in the body and create more substantial health in the womb. The second fertility tongue that I see often is a tongue that has toxins. And it's got red spots or maybe a yellow or a greasy coating. That can show that there's too much heat that's trapped in the body. Imbalances like this can influence hormone stability and possibly cause ovulation disorders or imbalances. Sometimes I'll see patients that I have with PCOS and they may have a tongue like this. The best thing to do if somebody has a tongue that shows toxin is to increase an intake of cooling foods like cucumbers, and then there's melon. Even green tea can be cooling. There's different foods and categories, and possibly looking at a detox tea like dandelion, although they don't want to be doing a full-on detox while they're trying to get pregnant. I don't recommend that at all. The next tongue is poor circulation. We're looking at more of a purple or a blue tinge to it, especially on the sides. And this points to more stagnation of oxygen flow in the body. There can be a little bit of blood stagnation as well. And this can indicate potential blockages that impact the reproductive organs. And possibly this could lead to some of my patients that have this kind of tongue. They have endometriosis or fibroids. One of the things that someone with a poor circulation fertility tongue can do is focus on activities like regular exercise, breath work or breathing techniques, a slow flow of yoga, and stress reduction will help this as well. Our next tongue is a blood stasis fertility tongue. This tongue looks like a dark purple tongue, often on patients that I see that have blood stasis. Underneath their tongue is distended, like bulbous veins. This can indicate blood stasis. So in fertility, what happens is this can manifest as painful periods or even recurrent miscarriage due to poor uterine blood flow. If someone has blood stasis, This is something, fortunately, that can get treated very well with blood invigorating herbs. Of course, this is under guidance. So, my patients that have blood stasis tongues, we work closely together and I work with them on invigoration of blood to resolve this. Also, heat therapy can help and regular exercise. There's specific foods that are really good to help with blood stasis. The last tongue that we're going to talk about is the dampness tongue. This fertility tongue, it's thick, it's sticky coating on the tongue. This can be a sign of dampness. And in terms of fertility, this can relate to issues like PCOS or excessive cervical mucus. Some of my patients will have a thicker white coating. And sometimes what you'll see on the sides of their tongues are tooth marks, like little bumps, because their tongue is too big for their mouth. And that's what they say, that's what it feels like. One of the best things to improve this fertility tongue of dampness is to focus on reducing or eliminating dairy, and sugary foods really cause this tongue. I encourage them to introduce more bitter foods or pungent foods like kale and garlic, and that combats the dampness that gets stuck in their bodies. Tongue diagnosis gives a lot of insight into fertility challenges. And when I look at these signs and symptoms and I combine them with dietary recommendations and herbal recommendations or herbal remedies, all of this will contribute to better reproductive health. Drop me a line below with the word tongue to get my top 5 photos of fertility tongues and specific steps to improve overall fertility health based on what these tongues are showing me. Thank you so much for watching.